views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
The Bronx is filled with health facilities of all sizes. New technology for advancements in the industry are coming to our borough every day. Coming up, we'll explore healthcare and the many programs and services being offered right here in our community. I'm your host, Joe Kelleher, and I want to welcome you to Bronx Now. Hello, welcome to the Bronx Now and our BronxNet East Studios at Mercy College, where we'll explore the ever-growing and developing borough, the rich culture, the innovative technology, and all things that make the Bronx a great place to do business. I'm your host, Joe Kelleher, and on this episode, we'll take an inside look at healthcare and healthcare facilities in the Bronx. Let's go out and see. Welcome to Westchester Square Physical Therapy here at the Hutch Metro Center. We're joined today by Dan Seidler at this state-of-the-art facility, and we're so excited to be here together. You can see behind me we have this therapy pool, and Dan's going to tell us a little about that. But tell us a little about Westchester Square Physical Therapy. What is it all about?
WSPT, we started in 2002, and we provide world-class physical therapy services right here in the Bronx. We have 2 offices in the Bronx, 1 in Yonkers now. And now we're also a part of the Motion PT group. We partnered with Motion a year ago, and we're looking to expand around the Bronx. We're the world-class provider of physical therapy.
Well, we see this pool behind us, and I think it's one of the only therapy pools. Yeah. And I don't know if it's regional or is it in the Northeast. I don't think there's many of these in a building.
We're definitely the only one in the Bronx.
Okay.
There are a couple of pools just like this around the tri-state area, but we have the only one in a physical therapy practice in the Bronx or in Westchester, and people come from all over to use it.
Who would use this pool as part of therapy? Is it
anyone? Anyone and everyone.
What type of injuries? Or
typically people who have chronic pain or have trouble walking on land. If they're having a hard time exercising on land, standing up, you get in a pool and you can do just about everything. So it makes it that much easier. You become a lot less, almost weightless. 80% weightless up to you. If you're up to your chest in water, you're 80% weightless. So you can do a lot of things that you could never do on land. So we'll have patients who can barely walk. They can get on the treadmill in the pool because there's also parallel bars there on the treadmill, and they can do things that they wouldn't be able to do. Now, we also use the pool for athletes, so high school, college athletes who are trying to get back to their sport. They may not be able to run on land yet, or even walk on land after surgery or after a bad injury, and they can do that in the pool. They can exercise in the pool and then start applying that stuff to land.
But you do have a full facility of weights and aerobics.
We have a full, first of all rehab equipment, a full gym of rehab equipment, in addition to a fitness studio, which we use. It's basically a rehab functional fitness studio. So patients will do functional activities such as walking, getting up from the ground, and higher level functional stuff like running, skipping, jumping, going in and out of obstacle courses and things like that. It's a bamboo floor, and you can basically do any sort of functional activity. Anything you might do in a gym, we do here, and it's under the supervision of a PT. So they're really guided as to how to do things in effective ways.
So what are the benefits of the physical therapy?
Well, first of all, there's a big push in the medical community to avoid unnecessary tests. People want that test because they've heard that they should get it, but the model is definitely changing, and orthopedists are are very on board with this, that a lot of tests are unnecessary. So a lot of patients, once they're evaluated by a doctor or a physical therapist, often the first recommendation is PT. So it's physical rehabilitation, things that are low intervention, no medication, and no injection or test, radiographic tests necessary, so no radiography type stuff. With a good assessment from a PT, first an orthopedist and then a PT, patient can get a very specific plan of care.
You've done so many great things in the Bronx, having this service. I think you started out in Westchester Square, hence the name, and here you are today at the Hutch Metro Center. Is there anything that you'd like to let the people in the Bronx know about Westchester Square? What should be the takeaway here?
Well, I mean, I've always been very committed to patient care. I've always wanted to do whatever I could to make the patient physical therapy experience as comfortable and as enjoyable as possible. It's the sort of thing that nobody looks forward to going to physical therapy.
Sure.
I
can attest to that.
Yes, you can vouch for that. So I figured let's make it a nice, comfortable, welcoming environment. Make it a fun experience, open and social, in addition to very professional. So that's what the WSPT experience is. And being here, being in this location, has made that really easy. It's a great site. Our office is open and airy. The Hutch Metro Center is just an amazing place for patients to be able to do a lot of their medical stuff. They'll come here for PT. They go to the eye doctor down the hall, go to the dentist down the hall, go across the street to to their ENT, and it's convenient. So that really helped. That has helped us.
Well, it's pretty amazing. Well, we want to thank you for what you do for all the people in the Bronx. And because you're here, we have a healthier Bronx. Thank you so much, Dan.
I couldn't have done it without you, Joe.
Thank you, Dan.
Thank you.
Good to see you. So good morning. Here we are at the Hutch Metro Center at University Diagnostics Medical Imaging. Today we're very pleased to have Dr. Mark Prager, who's the medical director of this medical practice. Thank you for being here, Doctor.
My pleasure.
So Doctor, tell us, how many people do you employ? I know you have a pretty big operation here.
Every day it gets bigger. I believe we have close to 100 employees, full-time, approximately 70 part-timers. We see well over 350 patients a day. All sorts of diagnostic studies and imaging is performed here on a daily basis. And we are the largest private medical facility doing diagnostic radiology in the entire borough, and if not in the entire city.
Now, where are your patients coming just from the Bronx, or are they coming from other places?
They're coming from all over the city. They're coming from Brooklyn. They're coming from, in fact, Israel. They're coming from Canada. We have a lot of specialty work that we do here: interventional radiology, PET CT scanning for oncology, MRIs, of which we have two. We have the highest field open MRI. It's an MRI without walls on it.
So if people don't want to go into one, they can
and have a very accurate, high-resolution study, and especially in this borough where we're dealing with patients who are anxious with obesity. We have weight capacity that can accommodate these patients at all times.
So technology is always changing. So what's happening in the field of radiology? Are you introducing new equipment? I mean,
Yes, in fact, well, this home of ours, the Hutch Metro Center, which I've been here for now going on 15 years, we are presently going to expand and taking over another 3,000 square feet, of which we'll have a state-of-the-art PET CT scanner with a multi-slice CT scanner, which is more sophisticated than presently that we have. It's a higher resolution imaging device. And we're also opening up an interventional suite. That means we're going to be doing things where we can do biopsies of tumors, catheterizations, biopsies of the liver, of the kidneys, and placing catheters for patients who need chemotherapy and as such.
It just seems that radiology is so important today. When you have a condition, right? You don't know what's wrong. The doctor
Right.
says, I have to send you for these tests.
Right.
So really, you're the first stop of people coming in and finding what's really going wrong so they can be treated?
Well, we like to say that we know you from the inside out,
Okay.
so to speak. Medicine and technology has changed such where the old days of listening to your heart, palpating your abdomen, feeling for
Right.
things, doctors don't have time to do those basic, routine, rudimentary studies. We do. Patient comes to us, it's either ultrasound, and we're looking into your belly, looking at the gallbladder, CT scanning, looking at every part of your body, bone scans, looking at the complete skeleton, MRIs, looking at your brain, your spine, your knees, your ankles, your hands. Every part of your body we can look into and see what's going on.
How long have you been practicing radiology in the borough of the Bronx?
I hate to date myself, but it's 30 years.
That's amazing,
30
Doc.
years I've been here. Yes.
Well, we're so happy that you're here providing medical services to the people in the Bronx so that they can be treated properly with the state-of-the-art equipment that you have here. Thank you for all of you do.
Well, I want to thank you personally, Joe Simone, and the entire complex, because it wouldn't be possible if they didn't have the expertise to do what they do.
Doctor, thank you for your time on this
My
beautiful
pleasure.
day. So we're here this morning at Montefiore Medical Center, one of the largest employers in the Bronx, with health facilities across the entire borough. And this morning we are joined with Dr. Suneet Jariwana.
I'm an allergy immunology physician at Montefiore, director of allergy immunology research in the division of allergy immunology.
Great.
And thanks for having me.
Well, thank you for being here this morning. So tell us a little bit about the condition of asthma and why we're going to talk about this technology that you've come up with, which is pretty amazing. But let's talk about asthma itself in the Bronx and why is it so important to be aware of this?
Sure, absolutely. So asthma is a huge problem in the Bronx, reaching epidemic proportions nowadays. And at Montefiore, we see asthma prevalence rates at least 3 times the national average.
And so how is Montefiore educating people in reference to how to treat asthma?
At Montefiore, we have an on-site Montefiore Asthma Center, which is a team-based approach involving an on-site asthma educator, as well as a pulmonologist, allergist, and we all deliver comprehensive asthma care per the national asthma guidelines.
Okay, and I know the technology today is it's amazing how it's just exploding, and everybody has an iPhone, everybody has an Android, and I understand that you're about to launch an app that addresses this condition of asthma. Can you tell us what made you think about doing this, and how is that going to help patients?
Definitely. So we developed this asthma educator app for smartphones, tablets, iOS, as well as Android devices. And this is really aims to develop, or at least deliver a comprehensive asthma care in the primary care setting, where barriers to asthma education include massive time constraints. And this app delivers animated videos as well as games, has been developed for kids as well as adults.
So this will be helpful in identifying the asthma condition or treating them.
This will be to deliver asthma education in a personalized way, and eventually to deliver push notifications for medication reminders, adherence support, and patient self-tracking through our patient portal.
That's amazing. So how would you say that technology in general has changed the dynamics of delivering healthcare services today?
Definitely. So for patients, definitely engages patients, delivers patient education in a personalized way, and also helps providers by at least helping patients take charge of their own asthma.
So we're looking forward to all these advancements in technology, Doctor. Thank you so much for taking the initiative, had the vision to do what you've done. We want to thank you very much for being here today to share your vision.
Thanks for your interest. Really appreciate it.
Thank you, Doctor.
Thank you so much.
Thank you.
Thank you.
Hey everyone, here we are at Hutch Metro Dental at the Hutch Metro Center, and we're here today to learn about all things dentistry. And to join us today we have Julia, who is one of the owners of this practice, who I think came here almost 15 years ago.
That's right, that's right. We've opened up in 2005. I remember I walked into this building and there was nothing but concrete.
Right.
And yes, and I was actually very cautious because I was wearing shoes on the heels. But I was very excited, and we were so happy ever since. And we feel very nice and very welcomed here at this building. We feel like a part of the family.
Why did you choose this location? Because when you came to this building, there was nothing here. We're in this area of the Bronx. There were probably other dentists in the area, but for some reason you had a vision to be here at the Hutch Metro Center. Why did you choose this location?
Well, at first, the location seemed to me very new and approachable, and we wanted to be a part of the Bronx community to deliver the services to the people who live in the Bronx.
This is not just a regular dental office. There's an experience that the patients they get when they come in here. Is that important to you?
Absolutely, absolutely. This is actually why me and Dr. Kushensky decided to build this practice, because you know, when you think about teeth, when you think about dentistry, many of us have 32 teeth. Sometimes it's more, sometimes it's less. The dental issues more or less the same. Obviously, you know, they vary from person to person. But when it comes to the the approach, it should be personal. For us, the dentistry, and I believe the medicine should be at anywhere as a personal thing, because you know every patient has different level of anxiety. You know, people don't like dentists, people don't like doctors. So we decided to take a different approach. We manage our patients with the different technology that we have available in the office. We do use nitrous oxide mainly for our small patients, for our pedo patients, because it's important to have that positive attitude toward dentistry from the beginning. Like that fear that we have towards the dentistry, it didn't just, you know, happen. We developed that, whoever, you know, has the fear of the dentist at a very early age. So we try to calm them down. We offer the nitrous oxide. For our adult patients, let's say if we extract the wisdom teeth, we offer them the sedation. So it's almost partial hospital-grade sedation that one of our oral surgeons uses.
Can you talk about the patient care aspect too? You have people here that are caregivers. They're setting up a program because people don't know about how to take care of their teeth, what kind of program they need. How do I deal with my insurance? I'm confused. What do you offer here to help your patients?
Every patient comes and they being seen by a healthcare provider. A certain diagnosis and a treatment plan is being proposed to the patient. After that, the patients are being seen by the treatment coordinators. And at the treatment coordinator center, they're being explained what kind of treatment will this patient needs to have done. Kind of the simple language, because, you know, based on the doctor's notes, obviously in the diagnosis, we explain them step by step how many steps that will take, how your insurance will work. You don't need the pre-authorization from the insurance company. Is there any out-of-pocket expense? If yes, what kind of payment options do we offer? And we do offer many of them.
What would you say to the people in the Bronx about the importance of taking care of their teeth and coming to a practice like this? What's the message? What do you want them to know?
I would like them to come to see a dentist on the regular basis, whether it's our practice or it's any other dentist. It's important to keep the good oral hygiene, take care of the diet, and, you know, eliminate the bad habits if there is any.
Right. Well, Julie, you know, we want to thank you for all you've done since you've opened this practice. I don't think there's a person that I don't talk to, you know, in a group that hasn't been to your dentist practice here because of all the wonderful things you do. So we love having you here in the Bronx. Thank you so much for being here and continue the great work.
Thank you. We're going to try our best.
Thank you so much.
I'm a periodontist here at Hutch Metro Dental. I've been with the practice for about 5 years now. What we do here as a team is we provide comprehensive care to patients, whatever their needs may be. I personally treat periodontal disease, gum disease, which is probably the most prevalent condition that affects adults.
I like to focus on that for a second. I noticed that I mean, you hear that oral hygiene is probably one of the most important things for preventive care.
Right.
Is that true?
Yes.
Okay.
It is true. Hygiene.
Basically, if they're not taking care of their teeth, they're coming to you, and then they have these conditions that have to be treated.
Right, and hygiene is most important. Anything that we can do works only as good as you can keep it.
Right.
So it's paramount. Whatever treatment the patients need, hygiene is the most important thing, and we're here to educate patient, to reinforce the hygiene practices, correct whatever deficiencies that there may be, and make sure that patients are comfortable and healthy.
And what type of procedures do you have to perform on patients?
A variety of procedures. Sometimes it's preventive care, sometimes it's surgical treatment, regenerative treatment, corrective treatment for either deficiencies in alveolar bone, that basically retentive bone that holds the teeth in place, or soft tissue. We also replace missing teeth with implants, bridges, and provide rehabilitation to patients who are edentulous or don't have teeth.
Yeah, you read a lot about implants today. It seems like that's the way to go. Back in the day, everybody, I guess, wore dentures or removable teeth. Now it seems that the implants are the way to go.
Implants are great. Implants are great, but there's nothing better than what the nature provides. So it's always a good idea to keep teeth if they could be saved. Implants do work great if that's not an option. But and we try and find a balance here.
Right.
You always want to try and do something that also has a good long-term prognosis. If you're saving a tooth that's not, in this day and age, sometimes being heroic is not worth it. In terms of the discomfort that the patient may be going through to save a tooth that doesn't have a poor prognosis, an implant may be a better way to go for it.
You know, a lot of patients are, always concerned about the pain and discomfort, and there's always a fear, it seems, like coming to the dentist. But I know that this is, I always call this like a dental spa, really. It's like people come in here, they have a whole experience seeing their dentist, and how do you make them feel comfortable, and what types of treatments do you offer to sedate pain and things like that? What's happening in today's technology too?
First of all, you try and find a personal approach to a patient first to make sure that they're comfortable. If they do have some kind of dental phobias and anxiety, we provide oral sedation, nitrous oxide sedation, or intravenous sedation here as well. So we do sedate patients here for certain procedures, mostly surgical procedures, but it's definitely available here. We do have a surgeon who does that here.
When a person has a problem with their teeth, does that affect other sense of well-being? Does it affect other parts of the body? I mean, I've heard that if something's happening with your teeth and you're not really taking care of it, it could cause other issues. Is that true?
Well, the dental apparatus, the dental system, the oral system is very finely tuned. Imagine having a little rock in your shoe. You can walk around and go about your normal daily activity. Imagine having a little pit stuck between your teeth. It drives you nuts. Imagine having toothache. It affects your everyday activities, living and being. So it definitely affects your well-being and overall mindset. There are other systemic conditions that are affected by certain oral problems and oral health type. Periodontal disease is associated with certain systemic conditions, and there's a two-way relationship with those conditions. So treating oral disease definitely improves the overall health of the patient as well.
That's great. Well, doctor, I want to really thank you for taking the time out of your busy schedule. I know you have a lot of procedures to do today.
Thank you.
And the fact that you've come here to share this knowledge with us and the people in the Bronx is really appreciated. Thank you so much, Doc.
Thank you.
Okay, thank you. We had the opportunity to speak with Lorraine Cashin, Program Director for the Physician's Assistance Program at Mercy College. Let's see what this program is all about.
Well, the PA program here is a master's program designed specifically to cater to the underserved population. That is our mission statement. And then as you see here, we just got our new simulation lab. So we bring students in and we simulate different types of scenarios. We would probably do like an asthma patient, right? Because he's got oxygen on, and
Right.
like an asthma patient. So like we would have him like breathing really deep, and his chest would come out.
And that would be from inside.
Yeah, we would control it from the control room. We would watch the students perform and grade them. So
Right.
if it's an exam, we
You
watch
can video them too?
It
So you can
videos
play back the
them.
tape and show them?
And show them. We do a debriefing, so
I
we're
had no
able to
idea
show
that you
them.
guys
like-
had such sophistication back here.
So we're
Guys-
able to show them, like, this is what you did really great,
Yeah.
and this is where you could improve
Right.
a little bit,
Yeah,
or
yeah.
maybe. So, yeah.
We spoke with students about their experiences breaking into the medical world here at Mercy College in the Bronx. So I'm curious, what brought you to the Bronx? Why come to Mercy? You could have probably done this program in many other places.
Yeah, well, I looked at a bunch of different other places, but I really liked the mission statement that Mercy had about serving the underserved, and so that really kind of caught my interest.
One of the main reasons that I chose Mercy was the community outreach, where they're based in the Bronx, and they're big on getting us to interact with the locals and experiencing the various cultures in the Bronx, and also the medical mission trip that they go on every year.
An important aspect about Mercy is we have our own Clin Lab where we have our mannequins and we can learn so many different tasks that we would actually do in the ER or at any field. So whether we would be in the ER or primary care, you would be putting an IV. So what's always doing is we have an arm mannequin that would teach us how to properly insert a catheter so that we know before going out into the actual field.
Mercy College definitely is setting an example with their mobile health to take what we learn and bring it out to communities. Honestly, I couldn't see myself being happy anywhere else besides here.
Lance, we're really happy that you're here, and we hope you enjoy the rest of your semester here at Mercy College.
Thank you.
Thank you. Students travel far and wide for this unique program, providing them with training in the Bronx community and abroad, preparing them for careers in the healthcare field. Thank you for tuning in. We hope you'll join us as we continue to explore our great borough. I'm Joe Kelleher. Until next time on Bronx Now.